Hi, my name's Emily. I'm a specialist perinatal occupational therapist with the perinatal mental health team. So perinatal mental health, we work with individuals who are pregnant or have a baby up until the age of 1. They will have complex or severe mental illness, which might be kind of long-standing, or it might be something that they've developed during the perinatal period. And so as occupational therapists, we think about their occupations as being a parent. So when they're pregnant, we might think about how well they're bonding with their baby. We think a little bit about how their physical health is affected. So we might see women that have kind of got long-standing physical health conditions, or we might see women that are developing kind of perinatal specific conditions. As an occupational therapist, we work with a multidisciplinary team. So we work with psychiatrists, psychologists, social workers, we have clinical nurse specialists, we work with our nursery nurses, and we have peer support workers who are all trained in working specifically with individuals with perinatal mental illness.
So I'm Nadine, I am a forensic occupational therapist and I work in the community forensic psychiatry service up at the Windsor office, but also we have a site in the north covering Peterborough. So my role is to support the individuals that I work with in their recovery with a focus on productive, leisure and self-care occupations. This includes interventions with a vocational emphasis as well as functional and reablement approaches. I'm also a sensory integration practitioner, which is a very effective frame of reference to implement when working with those who've experienced trauma, which so many of our service users have. I've also developed a varied therapeutic group programme, which includes the group you've seen today, the Growing Group, to support rehearsal of skills, social reintegration and engagement in meaningful activity. I really love my role and I find this occupation to be a fulfilling and rewarding one, working with people who are often marginalised and experience occupational deprivation.
Hello, my name's Bridget Gaynord. I'm an occupational therapist.
Hi, I'm Anne. I'm the NRS occupational therapist based at Huntingdon Service Centre. Okay, so how does it work? So when we collect equipment from service users, we have a fleet of drivers who go out and do collections when equipment's no longer required. And they load things into their vans from all over the area, and then it comes back to the service centre. And the vans will come into the back of the warehouse and unload the collected items into the cleaning intake area, and then they go into the refurb area. So anything electrical is then tested, and hoists are tested for the weight capacity to make sure that they're still fit for purpose. And then when things are good to go back onto the shelf, they will be put back onto the shelf by the pickers, the warehouse team, ready to be reordered.
So the other part of the equation is new product. We do have to buy a considerable amount of new product as well to meet growing demand and replace items which have been retired. So new goods arrive at the clean or the front entrance to the service centre, where they're met by Dave and his goods in team, who are responsible for checking that what's arrived is what is actually ordered and needed and fit for purpose, and then ensuring it is labelled.
My name's Kate and I'm an occupational therapist in the specialist eating disorder service at Cambridge. So what we're doing here today at Cats Protection is we're making links with a local charity. It's a charity I've worked with before, where I worked at a previous hospital, and we set up a fostering pen there for patients to look after. So I've re-established links here, and we've brought a patient today who's interested in volunteering roles, and we've had a look at some of the cats and talked about their recovery process, and it's around productive roles and occupation. So animal therapy is beneficial in many ways. It fits in with people's interests and productive occupation potential with volunteering, and it gets them out the house when they might normally not do so.
was recommended this experience by my CPT therapist, and it was explained to me that it would kind of get me out of the house, whereas I would usually stay inside a bit more. So it'd be like a little nice experience to get me like going out, experiencing new things.